Hello and welcome to the program. I'm your host, Neal Howard. Thank you for joining us here on Health Professional Radio today. Our guest is Dr. Jyothi Rao. She's co-author of the book, Finding Balance, Empower Yourself with Tools to Combat Stress and Illness, and she's been practicing medicine for the past 16 years, received her doctorate of medicine from the University of Medicine and Dentistry of New Jersey, and completed her internship and residency at the very prestigious New England Medical Center in Boston, Mass. And she's here with us to talk about, of course, her book, Finding Balance, Empower Yourself with Tools to Combat Illness, Stress and Illness, which she co-authored, and also to discuss heart disease and stomach bugs and how the bacteria in our gut affects our health. Welcome to Health Professional Radio, Doctor.
Thank you very much.
Thank you. Now, you've been here with us before in other segments, and when we were here before, we touched a bit on just how bugs in our stomach greatly affect our health. Now, you're the co-author of the book, Finding Balance. Tell us how you found yourself in a position to speak both on holistic medicine and Western medicine as well.
So I've begun my journey in medicine about 20 years ago, and the evolution of it has been to constantly try to find not just the Band-Aids to fix the symptoms, but also to delve deep into what the root of the problem is. And going into learning about functional medicine, which is about how the body functions and how it breaks down, a lot of it led me back to the gut, which is kind of the center point for all where we perceive that illness begins. And that's mostly because of all the bacteria that's in the gut, and those bacteria give us about 3 million genes, which when we have 23,000 genes as humans, we're then 10% of our bugs. So if our bugs aren't happy, we're not happy.
Yeah. Now, being that we are at least 10% bugs, why do you think, in your position as someone who can speak both on traditional Western medicine and medicine from a holistic point of view, why do you think that more holistic practices aren't more widestream?
Why they're not? Is
Yes.
that what you're saying?
Yes.
Yes. So I think the issue is that the data coming out is fairly new. In the last 5 years, there's been an explosion of information on the gut microbiome and all the genes that it gives us. But it takes about 15 to 20 years from new research to get into mainstream medicine.
Okay.
The other issue is that a lot of studies and a lot of treatment protocols are based on pharmaceuticals or drugs. And part of it is that that's the foundation of how we learn in medical school is treatments for either surgeries or medications for illnesses. And I'm not saying there's anything wrong with that. It's actually very beneficial for the right person. The thing that we don't do enough in medical school is teach patients how to stay well and to also do lifestyle changes that are so beneficial for many illnesses. And that's really what we delve on in the book, is really lifestyle modification to deal with illness.
Is lifestyle, when you say lifestyle modification, are you talking about something separate from diet modification, or is your diet being changed part of your overall lifestyle change when it comes to a holistic point of view?
Yeah, so I believe that 80% of lifestyle choices begins with what we put in our mouth as food. But not only is it important that what we're eating, it's also important what we're not eating, equally important. So if we are eating foods that are high in saturated fats and preservatives and processing and genetic modification, and we follow it up with a ton of kale, that doesn't actually fix the problem. What we want to do is try to get rid of the offending agents first. And what we have found is that the more plant-based that the diet is, that they foster better bugs in the gut, which then lead to less inflammation causing other illnesses. So our foundational principle is always starting with the diet and getting rid of things that can cause inflammation to begin in the body.
Is your goal 100% of the time to replace pharmaceuticals with holistic modalities, or do you find yourself, I guess, case by case, deciding that maybe a person should use these modalities in conjunction with what their physician is prescribing them, or maybe you're prescribing them something other than a supplement?
Absolutely. I feel like the issue is that we need to be very holistic and integrative, basically. I don't think one modality is right or wrong. I believe that each patient should be individualized, but lifestyle changes have allowed, implementing those for my patients have allowed both Dr. Agarwal and I to reduce their burden of needing prescription medication. So usually what I do is I start with a set of medications and we use lifestyle to change it. For example, with heart disease and hyperlipidemia or high cholesterol, changing a diet to going more plant-based has reduced my patients' lipids by 80 points.
Oh.
Therefore, their need for their cholesterol medicines go down dramatically, same as their need for their blood pressures decrease dramatically. So oftentimes we're just weaning people off of certain doses as they continue to employ more and more lifestyle changes. The other things we talk about in the book are a lot of it has to do with sleep and rest and, mind-body balance. And as people get healthier with that connection, there's a lot of benefit that happens with the body where you're not needing as many prescriptions.
Talk about the reception that you get from practitioners of traditional Western medicine once they read your book and give you some feedback. What are you finding? What are you hearing?
So it's been very exciting and encouraging. We've done grand rounds and we've talked to physicians in different settings, and most of the time they're very excited by the information. I think a lot of physicians are actually looking for ways to offer patients some healing tools, not just the Band-Aids. And I think 9 out of 10 times, most physicians embrace us and want to learn more and are looking into fellowship programs and where can I learn more type of questions come up and how do I get more information on this and all of the things that we want. We want to invoke excitement for physicians, and it's happening. Dr. Agarwal is now teaching and practicing cardiology at University of Florida, where she's interacting with medical students and residents and fellows, and she's had an overwhelmingly positive response about the excitement about introducing these concepts since they're not taught in med school, or they're just beginning to get taught.
As co-author of this book, how do you talk to the patient about letting down their guard or trusting in another modality than one that many of us have been raised with well into our 50s or 60s, and now you're offering a new modality in the holistic realm? We may be a bit skeptical. What's the one thing that you could say to that skeptical patient in order to help them along the path to get the maximum as far as health is concerned?
So I always ask someone to start with the elimination diet, and I say, give me 4 weeks. Just give me 4 weeks to see if you feel anything has changed in about 4 to 6 weeks. Now, it doesn't mean dramatic change. It means slight, I'm less tired. People say subtle things happen, like they're not falling asleep at 7 or 8. They're staying up till 10. They're not as bloated. They're not as distended. Their gut's starting to get better. Their brain fog is improving. Slight things start to change, and we get buy-in very quickly because of the fact that they actually do feel better in a short period of time. It's not perfect, but it's enough to keep them asking questions, saying, what else can I do? So usually what we do is we ask people to make one change, do one thing for the next 4 weeks and see if anything anything has gotten better. Most times, and that's usually 100% of the time, they're always coming back and saying, it absolutely did. I was shocked at how much better I feel. My joint pains went away, and all sorts of, unusual responses in their mind. But for us, it makes complete sense because once you do change the diet, your inflammation goes down and all the itises tend to start resolving. So we start with diet. We usually start with sleep. Those are the two things that we try to focus on in the beginning so that your body has good nutrients coming in and you're allowing rest to help you heal. So we usually have people try a couple of things to either foster a change in diet or sleep first.
Now, as a holistic practitioner, you mentioned sleep, rest, supplements. I'm sure you're versed in acupuncture as well. But how does spirituality play into your view of a medical practitioner?
That's a great question. I believe that it plays a huge role, and we do speak to mind-body connections. We talk about yoga, we talk about community, we talk about meditation, we talk about trying to, achieve a common theme with our community as well as our religious community as well as our, home community. But it is a huge part, and I think that playing on that mind-body connection and kind of talking to that is very under discussed in medicine, and we definitely are not doing a good enough job in terms of promoting that. I have to say that that's probably the next frontier for us right now, where we are trying to build on more of the meditation yoga practice just to get people started, but I would definitely try to encourage people to have a spiritual practice as well, and just to think about more of a universal good as opposed to just what's happening for them, because it does change the game so much in terms of the way the body starts to react. Our happiness is linked to it. Our ability to function well is linked to it.
And where can our listeners get a copy of your book, Finding Balance, Empower Yourself with Tools to Combat Stress and Illness?
So they can go to my website, which is rawwellness.com, or Dr. Monica Agarwal's website, which is drmonicaagarwal.com, as well as on Amazon.
Well, I sure thank you for coming in again, Doctor.
Thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.